So, hello everyone, a very warm welcome on behalf of the team of Homeopathy 360 from my side. I, Dr. Yashika Arora, feel privileged enough to be the moderator of today's session for all of you. So, I welcome all our esteemed guests and colleagues. Hope you are all safe and doing well during this lockdown period, as well as in such a pandemic situation. I hope everybody is in good health. So, for all of you who have joined us and who will be joining us soon, I, Dr. Yashika Arora, heartily welcome you all. And I hope everybody is excited to learn today on such a great, nice topic and innovative topic, and excited to learn the mistletoe about the mistletoe therapy that is Wiscom album. So before we begin this session, I would like to introduce you to the BGen's online education platform that is Homeopathy 360. You think we link the treasury of knowledge and hidden talents. Knowledge is strength, and we have always aimed to empower the people. Homeopathy 360 is one of the most updated portals for online publication of all kinds of course material for students, latest news and events, career opportunities, research updates, articles from great classical as well as contemporary practitioners, periodic literature, journals like Homeopathic Heritage and Homeobuzz, videos, presentations, synopses, etc. So we try to keep it as an exceptional education hub for each generation of homeopaths, whether he's a clinician or a researcher. As always, Homeopathy 360 has tried to connect homeopaths worldwide and broadcast their talent, aiming the advancement of homeopathy as well as homeopathic practitioners. So we try to organize each and every single information related to homeopathy and make it universally accessible on our portal, that is www.homeopathy360.com. On behalf of my whole team of Homeopathy 360 and BGen, I also invite all the esteemed homeopaths present with us right now to contribute your knowledge and experiences in the core area of your expertise. For that, you can mail me at yashika@homeopathy360.com, or you can directly upload your articles on the website for the same. But before we begin the session, I just want to thank the person behind this webinar, that is Mr. Manish Jain, the director of BGen Publishers, who have been working so hard to organize all these webinars and and promote homeopathy as through whatever platform we can. So, in the name of Master Samuel Hahnemann, let's just begin this session. I also would like to thank my whole technical team as well as promotion team who is of 360, who has been there to ensure that the webinar is successful. So not testing much of your patience, let me tell you the uniqueness of webinar lies in reaching each one of our learners personally and allowing every learner to raise questions to our speakers and get their answers right away. On your screens, you have a chat box wherein you can type your questions and send to us by pressing the button next to the box. We'll be running a question answer session at the end of the webinar, wherein you can clarify your queries from the speaker. You can raise your hand or put the chat box, put your question in the chat box. We'll try to solve them out. And now, without wasting any more time, I would like to introduce you to the dignified speaker of today's webinar. We have a great speaker with us today. So I welcome him on behalf of our whole team of BGen and Homeopathy 360. Dr. Zubin Marolia, sir. He's a senior homeopathic physician and integrative medicine oncologist from Mumbai. He's an expert in the field of cancer and homeopathy and has been treating cancer patients in India and abroad for last 28 years. He's one of the few homeopathic physicians who is trained in mistletoe therapy, a clinic who has trained in mistletoe therapy at clinic Alshim, Switzerland, where he worked with top European oncologists in cancer therapy, both curative as well as palliative. He has worked at Memorial Sloan Kettering Cancer Center, New York, in the Department of Integrative Medicine and at the Medical University of Vienna. Also, he has delivered his lecture at the prestigious Johns Hopkins University School of Medicine, USA, and regular lectures in Germany at Helixer on mistletoe therapy every 2 years. He will share his wide experience, including clinical cases from his practice on the management of cancer with homeopathic medicines and mistletoe therapy. So we are going to study today about the homeopathic management of cancer as well as an introduction to mistletoe therapy Viscum album. He'll be discussing the role of homeopathic doctor, what is the homeopathic approach in managing a cancer patient, how do you combine homeopathic remedies with the conventional allopathic drugs in cancer, what is integrative oncology, method in cancer treatment. All these questions will be answered by Dr. Zubin sir, and he is teaching a stepwise way how to manage a cancer patient and integrate homeopathy with modern medicine. So without let me not test anybody's patience. I hope everybody is excited. So I welcome Dr. Zubin sir with us, and I hand over the session to you, sir, now.
A warm welcome to everyone. Thank you, Yashika, for the kind words of introduction. A very good evening from India. And we begin.
Sir?
Yes.
Zubin sir?
Yes. Yeah. Right. A warm welcome to everyone in today's session on Sunday at 5 p.m. in India on a very, very challenging topic that is cancer. It's a very unique time that we face today. On one hand, we are having a situation of COVID-19 wherein there's a lot of fear of death. There is fever, there are complications, there are lung disorders. And on the other hand, we have cancer, which also is associated with death and dying. So it's a very, very unique coincidence that I talk on cancer today, which has been my work in the last 28 years. Homeopathic management of cancer. And I will be introducing you to mistletoe therapy, for which I have been doing my research since the year 1991. A little bit about my journey to every one of you. I have been trained in mistletoe therapy at the Clinic Alesheim in Switzerland. And then I have been using this therapy to treat.
Dr. Zubin, sir?
Yes.
Sir, please on your video and audio option on the screen.
It's on. It's on. It's on. Video is on.
Okay, sir, continue.
Okay, so we will be managing cancer patients, and how we use a homeopathic remedy in the management of cancer patient is what I will be teaching you today. So on one hand, we have COVID-19 with fear of death, and on one hand, we have cancer again with the fear of death. So how to achieve victorious in both these ailments, especially in cancer, is what I will speak on. So homeopathic management of cancer and introduction to mistletoe therapy. Cancer is a challenge. Cancer presents a challenge to medical profession even today. It has a multifactorial origin and multidimensional nature. It raises more questions than answers, more fear than courage, more suffering than cure, more denial than acceptance. So this is a very, very unique slide wherein you see a small person standing in a maze, and he is looking at the maze. as to which direction should he go. So this is the dilemma of a cancer patient who is standing in front of the maze and who has been diagnosed with cancer, and how he embarks upon the journey, whether he goes left and undergoes conventional medicine, whether he takes chemotherapy, radiation, hormone therapy, or he decides to go the alternative route wherein he takes homeopathy, alternative medicine, mistletoe, etc. So this slide is very, very particular to show the dilemma of a cancer patient. So we'll go very, very shortly to two concepts in cancer. One concept in cancer which we know is the cellular concept, wherein we know that cancer has been defined as an unrestricted and unlimited proliferation of cells. Till today, we know cancer is a local tumor, it's a local disease. You have a breast tumor, so you remove by surgery, or you have a colon tumor, you remove the tumor from the colon. The logical treatment today is to direct therapeutic measures at removing and destroying the malignant cells locally, looking at cancer as a very, very local and a small problem, not to mention the serious side effects of the associated therapies. So here you see a normal cell, and here you see a cancer cell that multiplies, that proliferates, becoming a malignant tumor. And this concept that I mentioned to you, the cellular concept, in which chemotherapy and radiation aims at destruction of cancer cells, but they have the limitation with the toxic side effects, the main one being immune suppression, as we all know. In fact, it is known that some of the cytostatic therapies are also carcinogenic. In fact, immunosuppressive treatments in the recipients of organ transplant raise the incidence of cancer many-fold. That's on one side. We have the cellular concept wherein everything is local, everything is regional. So you go inside, you go to the region and you remove the tumor. But is that the answer? That's not the answer. So you look at another concept, which is the holistic concept. That is where, as homeopathic doctors, we step in. So we understand that cancer is not just an unlimited proliferation of cells. A dynamic equilibrium is normally maintained in the body, in the organism, between the ever-present tendency of cells to multiply and differentiate and the controlling mechanism of the whole body, which maintains itself by limiting this multiplication of cells within normal growth. That's what happens in embryological development. So there are multiplying cells and there is a controlling mechanism or the vital force of the whole organism, which we say. It is when this equilibrium breaks down that cancer develops. In this holistic concept, Smithers had suggested the presence of form-giving processes in the healthy organism, which normally maintains a dynamic equilibrium with the ever-present tendency of the cells to multiply. So I want you to understand that there is a dynamic equilibrium that goes on in the body between multiplication and controlling this multiplication by what are called as the form-giving processes of the body, which are the defense mechanisms and the immune system of our body. It is when this resistance of the patient or organ that breaks down, it leads to cancer cells localization, formation of a tumor, and metastasis. So you have to understand this at the outset in today's webinar on the cellular concept and the holistic concept. And that's where, as homeopaths, we step in at the step of the holistic concept. A cancer cure cannot be effected by local measures alone. Too much importance is given to the prevailing loco-regional concept to achieve a destruction of cancer cells. In 1958, the malignant tumor has been given excessive one-sided attention, and its opposite number, the human organism, the whole organism, with its defensive powers, has been totally neglected. So as homeopaths, we come in the holistic concept of cancer management. So we know that cancer is not purely a local disease. Right from the beginning, the whole organism is involved and is called upon to defend itself. Until now, all medical research has been too wrapped up to achieve a local destruction of the cells. So what is the rational, holistic, or I would say integrative approach in management of cancer? The essence of today's talk, my dear friends, and all patients also who are attending, is to understand and to give you an understanding of integrative medicine and an integrative approach in cancer management, which is very important. So the rational, holistic management of cancer involves, number one, reduction of the tumor mass by surgery, which results in elimination of the tumor antigen dose. Number two is stimulation, reinforcement, and restoration of the reticuloendothelial system and the immune mechanisms by mistletoe therapy, helixor, constitutional homeopathic medicine, and thirdly, supportive therapies like meditation, yoga, music, relaxation, etc., wherein you achieve a total reorientation of life and because if you see the history of a cancer patient throughout the journey of cancer, you will always find that there will have been a disorientation in their lives, a disorientation at the psychological level, wherein you can have disappointment, you can have grief, you can have a lot of to give you some data on cancer in my practice today, from the 1st of January 2020 to 31st of May 2020, I saw around 38 patients. In stage 1, I saw only 5 cases, which came to me so early, including lymphoma, carcinoma of the rectum, carcinoma of the ampulla, multiple myeloma, chronic myeloid leukemia. In stage 2, I had 7 cases, cancer of the ovary, cancer of the lung, cancer of the colon, whereas the chunk of the cases that come to a homeopathy doctor were from stage 3 and stage 4, which is the cases that come to you with metastasis. So you see a lot of metastatic cancer of the ovary, rectum, liver, pancreas, lungs, etc. So nearly 60% of the chunk of patients you will see will be from stage 3 and stage 4. In stage 1 and stage 2, we use a lot of homeopathy treatment for reducing the side effects. And in stage 3 and stage 4, we have nothing but we have to offer palliative treatment. The role of homeopathy. The holistic and integrative approach in treating cancer is understood worldwide today as complementary and alternative medicine. In fact, now they have coined the word integrative medicine. Homeopathy, along with this holistic understanding of the patient, is a very important pillar of CAM or integrative medicine today. This is Memorial Sloan Kettering Cancer Center in New York, where I was working in 2009. I was fortunate to have worked with Dr. Barry Cassellett in the department to increase. This is the Filder clinic that you see in Germany. And over here also they have a department of integrative medicine wherein they use a lot of techniques. And one of the most beautiful techniques that are used for cancer patients in their relaxation and to help them meditate is music therapy and art therapy. So we're coming back to the role of homeopathy. So cancer is a journey. It's not a one-off disease wherein you see a patient and you see him for about 10 minutes and you give him a remedy and you achieve a cure. It's a journey from the time of diagnosis till the time the patient is cured or the time the patient is in remission. So the treatment of cancer involves an entire team, right from the family physician, the oncosurgeon, the oncophysician, the radiation oncologist, the histopathologist, the physiotherapist, and of course, the homeopathy physician. It is important to have a multidisciplinary approach and work as a team for the benefit of the ailing patient. Now, this becomes very, very important because you have to achieve integration at every stage of treatment. And the family doctor becomes a very, very important cog in the wheel in this journey of a cancer patient. because the family doctor and the homeopath will have to constantly be in touch with the oncosurgeon, the oncophysician, etc., to know what is happening to the patient in the cancer journey. I will be using this word, the journey of cancer, today many a time, and you will see in the cases that I will show you of what happens during the cancer journeys and how homeopathic remedies are helpful at every stage of the journey. So we know it's a long drawn process, and at every stage, a balance needs to be maintained between conventional medicine and complementary and alternative medicine. Surprisingly, several patients desire to take homeopathy medicines and alternative therapies in the full course of cancer therapy. It is done with the objective of strengthening the defense mechanism of the body as well as alleviating the side effects of immunosuppressive therapies. So we start with a detailed medical history of the patient, which the homeopath takes in identifying signs of early malignancies. Medical history also helps to reveal the tendency towards a malignancy based on the past, personal, as well as the family medical history. Many times you see cancer patients in their lives, there's a lot of cancer in the family, and the first question I ask is, do you have warts in the family? Do you have small warts on the neck, on the face, in the family? You will see a positive reply. Also, in the detailed medical history of the patient, as the patient is beginning the cancer journey, the psychological and emotional state and the behavioral pattern of the patient will be understood in more depth. So here you see what happens to a cancer patient. So the first slide, the directions that you see over here, is he lost? Is he confused? Distressed? Is he unsure? Anxious? And where is the solution? So cancer patient approaches the homeopath with a complex emotional quotient ranging from fear, anxiety, confusion, and even anger and denial. Enough time is spent with the patient for him or her to unfold and come to terms with the disease. Constitutional history taking has a psychotherapeutic value and helps the patient to embark upon the long journey of healing. Homeopathic remedies are given in 4 ways. You have the constitutional remedies, you have the acute specific remedies, you have the remedies for palliation, remedies to alleviate side effects, and the organ remedies. And remedies are given also in LM potencies, and for alleviating the side effects of radiation and chemotherapy, we use the lower potencies. I'm sure this slide must have caught your attention. Life is short. Break the rules. Forgive quickly. Kiss slowly. Love truly. Laugh uncontrollably. And never regret anything that makes you smile. So we now come to the introduction of mistletoe, what we call Viscum album in homeopathy. According to a custom in Europe countries, if a woman is caught standing under the mistletoe, a man can kiss her. For centuries, mistletoe has been considered a plant that increases life and fertility. By the 17th century, people believed a kiss beneath it could mend a broken heart. A man can only kiss a woman on the cheek and should remove a berry from the mistletoe twig each time he does so. Once the berries have gone, the kissing should stop. Does it? So you have the complementary therapies in the cancer journey, you have the holistic therapies, and you have the main therapy. So this is a slide I would like to share which shows on the right hand side that you see the conventional treatment that a cancer patient takes, that is surgery, radiotherapy, chemotherapy, hormonal therapy, and all these therapies aim at direct cancer destruction or cancer inhibition and intervening in the pathogenesis of cancer. Whereas on the left-hand side, you have all therapies that restore wellness and health, what is called as the concept of salutogenesis, wherein you have diet, exercise, lifestyle, natural remedies, mistletoe coming in, psycho-oncology, meditation, yoga, therapy, etc. And here, what we are aiming at, the therapeutic aim is to have indirect cancer inhibition or stimulation of the immune defense mechanisms of the body. So here you have restoration of wellness, and here you have direct cancer destruction. So these are the two poles in cancer treatment that a cancer patient faces. I would like you to look at this slide very carefully, because as a homeopathic doctor, you will have to understand the various factors that come in and contribute to healing a cancer patient. Salutogenesis. We always talk about well-being, we always talk about wellness, we always talk about how good you feel. But what is the actual concept? The actual concept is salutogenesis. It is a term coined by Antonovsky, a professor of medical sociology. And the term describes an approach focusing on factors that support human health, well-being, rather than on factors that cause disease. I repeat, the term describes an approach focusing on factors that support human health and well-being, rather than on factors that cause disease. The term salus comes from the Latin salus word, salutogenesis, meaning salus in Latin means health, and in Greek, genesis means origin. We are coming to understand health not as absence of disease, but rather as the process by which individuals maintain their sense of coherence, that is, sense that life is comprehensible, manageable, and meaningful, and ability to function in the face of changes in themselves and their relationships with their environment. You can imagine this is a concept called sense of coherence, in which the sense that life is comprehensible, manageable, and meaningful. What is called as SOC, structured, manageable, and meaningful. So this is again the same concept, wherein we have on the left-hand side the pathogenic concept, wherein it focuses on pathogenesis, wherein you have a biochemical intervention, physical intervention, a biochemical blockade. And here on the concept of salutogenesis, you have focused on the healing processes, the constitution, the lifestyle, and holistic quality of life. This is where, as a homeopathic physician, you will step in. And you will step in and play a very important role. Since 1920s, this saying was there. Do not get so taken up by the cancerous condition that you forget the most essential part of your treatment, the general condition of the patient. This is very, very important, the general condition of the patient. And herein I start with my first case. I was seeing an elderly lady with advanced uterine cancer in Mumbai a couple of months ago, and she had spinal metastasis, and she had a very, very big ovarian tumor. She was 84 years old, and she was taking radiation therapy from a very, very big hospital in Mumbai. And on the second week of therapy, she became very weak, and I was called for a visit. When I saw her, the first impression that you get from a patient is very important. As a physician, what is the impression you get from a patient? What does the face signify? What does the demeanor signify? What is the attitude of the patient that signifies? So I go to their residence, and I ask her son to bring her in the hall. And the son says that, no, Dr. Marolia, she cannot walk, not even from the bedroom to the hall. And I had seen her in the first consultation, wherein she was able to walk from the bedroom to the hall to converse. So I go to the bedroom where she's lying down, very frail, very weak, and I find her, the general condition is very, very low. The BP is low, the pulse is very, very feeble, and she is dehydrated. So her general condition of the patient, she's 84 years old and she is dehydrated. So you can imagine that currently she's on radiation, she's taking radiation for a spinal metastasis, and she is extremely dehydrated. So I step in over here as a homeopathic physician and I tell the family that no, you will have to stop radiation right now till she is absolutely fine, till she gains her stability, she gains health, and then you can continue with the radiation. So in homeopathy, we have a remedy, as we all know. We give a carbo wedge, 200 4 times a day, and we got IV saline, we gave her IV fluids, and we rehydrated her, and she was again walking, she was again talking, and we got her general condition stabilized, and she continued with the radiation for the spinal metastasis. So here you find that a homeopathic doctor steps in to examine the patient who's already under the care of an oncophysician and a radiation oncologist. So in the cancer journey, there are three people involved: the radiation oncologist, the oncophysician, and you have the homeopathic doctor. So here with carbo-wedge and homeopathy, we were able to stabilize the patient, and for the severe back pain that she had due to spinal metastasis, the radiation was helping her back pain. So her back pain got much better. She was started on mistletoe therapy, and carbo-wedge was continued till she stabilized and she was regaining her normal sense of coherence. I repeat, here, what was her sense of coherence that we had discussed? If I go back, it's very important. Sense of coherence reflects a person's view of life and capacity to respond to stressful situations. And it's a global orientation to view life as structured, manageable, and meaningful. What meaning is there to her life of the elderly lady if she's lying down in the bedroom dehydrated? So herein you see an integration. Here you see an integrative oncology approach wherein the radiation was helping a spinal metastasis, the mistletoe was tackling the uterine tumor, and homeopathy was stabilizing her. So there are numerous cases today in my second half of my presentation, which I will show you how a homeopath steps in, and the homeopath steps in with simple remedies, not high degree of evaluation involved. You see the keynote symptom and you prescribe the homeopathic remedy. Let's proceed. So mistletoe, I think everyone would like to learn about this wonderful plant, one of the most romantic plants in medical history. Steiner, founder of anthroposophic medicine, had recognized the importance of mistletoe in cancer therapy, and the first injections of mistletoe were administered in 1917. Can you imagine? 103 years ago. So what is the mistletoe plant? So let me take you on to the next slide to show you a bit more of what is the mistletoe plant. So what is Viscum album, my friends? So Viscum album is this bunch that you see that is growing on the host tree. So this is your Viscum album. These bunches that you see is the mistletoe plant. So it's a parasitic plant. It is growing on the host tree. This is in Switzerland, where the plantation of mistletoe is there. So mistletoe is a half parasitic plant belonging to the family Loranthaceae, and it grows on host trees like the oak, pine, apple, fir, elm, and others. So we know about the mistletoe, but what we don't know is the beautiful similarity of the mistletoe with cancer. In fact, there are so many similarities, some of them being microscopic, of how the mistletoe plant resembles cancer. The first similarity that Steiner recognized, what we call in homeopathy as the doctrine of signatures, is autonomy. The mistletoe emancipates itself from the normal biological rhythms in nature to which other plants are subjected. It is a half parasitic plant. A parasite normally lives at the cost of the host tree and often damages it, like cancer in the human body. Such is not the case with the mistletoe. The branches of the host tree, which are seized by the mistletoe, are sustained longer than the other branches. It has an inherent tendency for indefinite growth and proliferation. And if you see over here, you see how the plant is growing. It's growing in all directions. It is multiplying and growing in all directions, just like a tumor grows in all directions. Indefinite growth, just like cancer. Parasite, just like cancer. In fact, if you see the leaves of the mistletoe, they are growing in different directions and in different planes, again, like cancerous cells. In fact, if you see a leaf, the upper and the lower surfaces are undifferentiated, just like an undifferentiated carcinoma. I have already mentioned the branches of the host tree on which mistletoe grows are sustained longer than the other branches. Now, this is a very beautiful slide. This is one of my favorite slides that I show during my viscomalum and mistletoe preparations. They say that mistletoe actually helps to devour the tumor-like protuberances or excrescences which occur on the host tree on which it grows. In fact, it grows in those places where these proliferative growths appear and promotes a sort of a healing process. So this, in short, is a brief introduction to my presentation today, wherein I've told you about cancer. I've told you about how the two aspects of treatment are very important in the management of cancer. In fact, more than treatment is how you manage a patient and how you step in as a homeopathic physician in the cancer journey of a patient. The homeopathic physician, I repeat, is a very important cog in the wheel of the cancer journey of a patient. And how at every step he comes, steps in, coordinates with the entire oncology team and helps remission in a cancer patient. We proceed to the basic aspects of the mistletoe, that is pharmacology. The pharmaceutical components comprise of lectins, viscotoxins, flavonoids, polysaccharides, etc. Lectins basically are glycoproteins which are derived from various plant animals with a specific sugar binding capacity. They are of non-immune origin but of great interest because of their ability to recognize carbohydrate components of cell membrane molecules which are important in cell recognition. Now, this is very important. Cell recognition, because cancerous cells usually evade the immune surveillance mechanism of the body. This is important with regard to cellular differentiation and neoplastic transformation. Each lectin molecule comprises of two chains, A and B, covalently linked by a disulfide bond. The A chain hinders protein synthesis on the ribosome enzymatically, and the B chain binds the carbohydrate, non-toxic, and activates the macrophages. So just to show you a chemical picture of the lectin molecule, and there are three lectins: mistletoe lectin 1, lectin 2, and lectin 3. Now you see this slide. I want you to look at this slide very carefully. Here you mention about the systemic effects of mistletoe extracts, what mistletoe does. Now you can imagine there are 4 or 5 main components of the mistletoe, and each component, we'll start with the first one. We'll start with mistletoe lectins. And here the lectins, if you see, help in apoptosis, that is programmed cell death, wherein cells die, they are programmed to die. Lectins are also cytotoxic, wherein they kill the cancer cell directly. They have an effect on the monocytes, on the granulocytes, the white cell, and the natural killer cells, the NK cells. Viscotoxins also have an effect on 3 or 4 areas of the immune system. And all these molecules play a very important role in DNA stabilization of the mononuclear cells, wherein the DNA stabilizes and it does not get affected by the toxic effects of chemotherapy. So it goes to show the total immunogenic or immunostimulatory effect of the mistletoe in a cancer patient. Integral wholeness. The full mistletoe plant extract acts as a biological whole having both immunostimulant as well as cytostatic potential in cancer therapy. So you can imagine, as a whole, this extract, mistletoe plant, is one of the few medicines in cancer treatment that not only is cytostatic, affects a direct effect on the cancer cells, but also it acts as a whole, helping the immune system to fight the tumor. So the mechanism of action of mistletoe is immunomodulation, immunoprotection, salutogenesis and self-regulation. Cytotoxicity means effect on the cancer cells, and anti-angiogenesis. I've already highlighted how it protects the immune system, how it modulates and stimulates the immune system, and it also has a direct cytotoxic effect, and it has an effect on the neuroendocrine system, wherein it helps the release of beta endorphins and helps to regain the biological activity, the biological rhythm of the body, helping in better quality of life. So here we've seen that the mechanism of mistletoe in vitro studies programmed cell death when tumor cells were incubated with mistletoe extracts and lectins. For 20 hours, fragmentation of genomic DNA into oligonucleosomal fragments was observed. The cytostatic action of the whole lectin rests on. So you have the B chain that binds on the carbohydrate of the specific malignant cell surface, and the A chain is enabled to penetrate the cell membrane and inhibit the protein synthesis on the ribosome enzymatically. And the B chain at the same time increases the phagocytic activity of the macrophages. So here we come to a very interesting concept. This was the essence of my talk at the IMM 2016 conference in Germany, programmed cell death or apoptosis. So how does a cell die? And you have cells that generate, you have a cell that dies. So when a cell dies, what happens to the cell? Where does it go? Is it removed? Is it destroyed? Is it dissolved? So until recently, we all know that cancer was thought to be a process of cell proliferation. The cells multiply and multiply and you have a cancer. But latest research shows cell division and cell death are intimately linked. This regulation of either one, as occurs during cancer, necessarily involves the other. So you have cells that divide and multiply, and you have cells that die, and they are linked. Cell death, earlier, we only had the concept of cell death as necrosis. Cell burst out, the cell dies, the cell bursts and is dead. As early as 1940, Glucksman had recognized that cell death played an integral part of embryogenesis. And one of the commonest examples wherein the cell death enables formation of body parts is the hand, is the limb bud, wherein you have the entire limb bud, and because of programmed cell death, the cells keep on dying and your fingers are formed. So they are programmed to gradually die, and this helps in the formation of your digits. Research in the field of cell death has revealed how defects in cell death regulation can contribute to the development of a malignancy. Genes that are involved in regulation of cell death are targeted for mutation during the development of a malignancy. These molecules now doubly attractive as potential targets in cancer therapy. So here you have a slide wherein I have shown you on one side is cell division and one side is cell death. So when the population of cells has got an equal amount of cell division and cell death, we have the equilibrium in the body. You may remember in the beginning of the presentation, I mentioned to you something about equilibrium, something about the form, defensive processes in the human body. When cell death is more and there is less of cell division, you have a population contraction, which leads to degenerative disorders in the body. Whereas if you have more cell division and less cell death, you have an expansion of the population, which is cancer and malignancy. Just to go very basic, and then I'll show you a very basic diagram of apoptosis. Two types of cell death regulatory molecules are there. There are various markers. We won't go into details. Cell death inducers, which facilitate apoptosis, and cell death repressors, which block and delay apoptosis. So what is apoptosis or programmed cell death? As the word says, it's a programmed cell death. There are stages in which a cell dies, and then the cell is cleared from the body and new cells form. So apoptosis, please listen very carefully. A process whereby a cell, upon receipt of an appropriate stimulus, engages a set of molecules that cooperate to dismantle the cell from within. The process culminates in the separation of the cell body into many intact pieces called apoptotic bodies that maintain membrane integrity. Alteration of the composition of the plasma membrane of the apoptotic cell attracts the attention of nearby phagocytes. So I'm going to quickly show you a very simple diagram. So apoptosis is an efficient disposal mechanism for unwanted cells. Here you have a normal cell, and here the process of apoptosis has begun. And here you have cells that are dismantled into specific bodies, small bodies called as apoptotic bodies. And these apoptotic bodies are now engulfed by a phagocyte, and the whole process is as clean as you can expect. These phagocytes then eat the dying cell, a critical point before the cell has a chance to burst open and release the contents into the extracellular space. This can be viewed as a packaging process that facilitates disposal of unwanted cells by breaking into small pieces, and each piece comes with an attached label. I am dying, come and get me. It's so beautiful. The whole process. Whereas here in necrosis, the other aspect of cells that you see here in apoptosis, the cell is gradually broken down into bodies maintaining cell membrane integrity. Whereas here in necrosis, the cell membrane ruptures and releases the cell contents into the extracellular tissue. So this is more clean, and here you find the rupture of the cell happens. Again, the same way, here you see there's a rupture of the cell, and here the phagocyte engulfs the apoptotic bodies. Also, I mentioned to you about how mistletoe therapy helps in restricting angiogenesis, wherein there is new blood vessel formation that feeds the malignant tumor. So here you find this is a model in a rat who has a tumor, and changes of microcirculation in and around the tumor cells were studied, and after 35 days of mistletoe, the whole tumor has shrunk, whereby the whole blood supply to the tumor was blocked by mistletoe. So we'll quickly go through some research studies that have been done in the world. Mistletoe lectins are of high biological activity. The level of cytotoxicity is caused by inhibiting the protein synthesis on the cell on the ribosomal level. And the B chain, as we have mentioned, activates macrophages and releases lymphocytes. Again, you find another study of mistletoe extract. I'll take you to a very beautiful study on natural killer cell. So mistletoe viscotoxins increase natural killer cell mediated cytotoxicity. NK cell activity is now a very, very beautiful part, a very, very intensive part of research on mistletoe. And as we know, mistletoe extracts have immunomodulatory activity. and we show non-toxic concentrations of iscamalbum extracts increase natural killer cell mediated killing of tumor cells. Mistletoe extract reduces surgical suppression of natural killer cell activity in cancer patients. In fact, in one of the research in Force Complementar Medicine, it was shown that major surgery suppresses the natural killer cell cytotoxic activity, favoring hematogenic tumor cell dissemination. Again, something on lectins and apoptosis. Herein, this was the study that I want to share with you. That mistletoe extract reduces the surgical suppression of natural killer cell activity in cancer patients. So, if we have a summary of what mistletoe does, mistletoe primarily stimulates the immune response. Okay, it also stimulates the thymus gland with a dramatic increase in the thymocytes. There is a hypertrophy of the T cell dependent paracortical zones in the lymph nodes, and the full mistletoe plant extract acts as a biological whole, having both immunostimulant as well as cytostatic potential in cancer therapy. This is a very beautiful study done. It was published in PubMed. Everyone knows about the Chernobyl radiation disaster and what happened when the radiation took effect in the population in the villages surrounding the radiation reactor. 92 children between 9 to 14 years of age with recurrent respiratory infections due to the Chernobyl nuclear disaster were treated with mistletoe preparations because they had recurrent infections. And they were given many antibiotic courses. After mistletoe treatment, the frequency of the recurrent respiratory infections and the relapses decreased significantly by 78%. Picture of a 10-year-old Alexei at the Children's Cancer Hospital, Belarus, suffering from bone cancer. It was studied that effects of radiation increased the tumor incidence by 800%. So where is mistletoe indicated in cancer treatment? That again becomes very, very important. So number one, the first thing is it is very important supportive therapy during chemotherapy and radiation, wherein it gives you a lot of immunoprotection and improved tolerance of oncology therapies. It is used as an adjuvant therapy to prevent relapses after surgery or radiotherapy, and it is a palliative therapy for inoperable or metastasizing cancer patients. Also in precancerous lesions, many times in the oral cavity with submucous fibrosis and cancerous lesions that are precursor to a tumor, it helps involution of the precancerous lesions. So before we go on to the cases which I will be discussing, as I mentioned to you in today's talk, I have been highlighting the cancer journey and how a homeopath steps in at every stage of the journey of cancer. I had a case recently which I want to share with you, a case of pancreatic cancer that had come to me. Patient had was advised 8 courses of chemotherapy. With the first 4 courses of chemotherapy, the tumor came down to 50%. And with the remaining 4 chemotherapy courses, there was no change in the size of the tumor. So they finished 8 courses of chemotherapy. And they have been on concurrent treatment with me, with homeopathy and mistletoe right from the beginning. And there is the difficulty wherein now you have a suggestion by the oncologist that no, we need to give you more chemotherapy and a slightly more intensive form of chemotherapy. So on examination of the patient and on judging the patient when they came to me after the 8 courses, he still has the pancreatic tumor that has gone down by 50%. So I examined the patient in detail, and I ask him. So he's quite good, quite normal, a bit of acidity problems, and I ask him as to what would you like to do. It's very important to give the patient a space to decide what they want from life, what they want to do in their cancer journey. It's very important to ask this question to a cancer patient. So he says that I still have not decided yet as to what I want to do. It will take me a couple of weeks to decide. So I restudy the case and I continue with the mistletoe and with the homeopathic remedy. After 2 weeks, the family again comes to me and they mention that they would like to follow the advice of the oncologist and please and take chemotherapy, what they've advised, and they will continue in an integrative way homeopathy and mistletoe. I say, fine, it's okay, we'll go ahead. It's their calling. And then one fine day on the third week, he takes the first chemotherapy and he develops severe flatulence, acidity, and indigestion and loose motions. And the quality of life, like we mentioned, the sense of coherence got enormously affected. And he comes to me and he says that I'm shattered. I've never expected so many side effects to happen by the chemotherapy, which was the ninth one. The 8 cycles were over. And then we again sit down, and we ask him, what do you want? And then he says that I want first this acidity to go. And it's a very interesting case in homeopathy, how a beautiful symptom can be elicited. And I ask him, tell me your problem. Tell me your story. What is happening with you? So he says, I'm having severe acidity and I'm not able to digest food. And I have a lot of gas problems, a lot of burps, and passing gas from below, etc. So I ask him, tell me more. So he says, whenever I have a gas problem, I will stand up and say, I have a gas over here and I have a backache. So along with the abdominal flatulence, he has a backache and the back pain goes down to the lower limbs. And that remedy is very, very significant, wherein there's a remedy in homeopathy which says in the materia medica, flatus felt in the back. Whenever I have a gas problem, that he says over here, it is felt in the back, and I give him the remedy rhododendron in homeopathy. And the gas problem and the acidity issues are all solved. So we are still managing him. Please note, giving a remedy is part of the management. And then we sit down together and he says, I'm feeling much better and I have taken a decision that I don't want to continue the chemotherapy because the tumor is the same and I want to eat well. I want to have a sense of coherence. Remember what we discussed earlier? I want to eat well. I want to live a good life. So we gave him the remedy. And after the remedy, the gas problem, the acidity has subsided. He is eating well and we continue with mistletoe in a slightly higher dosage. Now something even better happens. So they take the opinion of a very, very prominent oncologist, an oncosurgeon who was also attached to Tata Hospital many years ago. And my judgment, when he came to me and we were discussing as to how he's feeling after he became better with rhododendron, was, now what do you want? So he says, Dr. Marolia, we want to take the opinion of another oncologist. So I say, fine, go ahead. So he takes the opinion and then he asks me, what do you suggest? I said, no. I said, you should not take any further chemotherapy. You should continue with homeopathy and mistletoe and you see and we will evaluate you. And the oncologist said the same thing, that this will impact, this chemotherapy will not have an effect on the malignant pancreatic tumor. It will impact your quality of life. It will reduce your digestive capacity. So the homeopathic opinion and the opinion of the oncologist was the same. Of course, this has come through years of experience of me seeing cancer patients and what do they want in their life. And right now, so he's doing fine. We evaluate him. He continues to be on homeopathic medicine and mistletoe therapy. We all know about the fear that cancer creates in the body, and how what happens to a cancer patient, what happens to the cancer patient's life. You will be forwarded a video clip of a certain interview wherein I have mentioned my concept of cancer treatment, the three S's of health, which you will receive by email. And in that, I have mentioned about the three S's, wherein you have suppression, spontaneity, and the free spirit in a cancer patient. How suppression at different levels in a patient's life affects and stimulates cancer growth. So before we begin the cases, I want to share with you this slide. So this slide is called EPOH, as you can all see. So some data exists of a research protocol for a chemotherapy drug called EPO, which had marginally positive results. One oncologist was demonstrating wildly successful outcomes. Why? Can you imagine what he said? Instead of injecting his patients with EPO, each time before the chemotherapy, he told them, I am injecting you with hope. He switched the name of the drug protocol from EPO, and if you see it the other way, it's hope. So beautiful. So the cancer journey stages, what happens before the cancer diagnosis, the actual diagnosis, the fear, the anxiety, the anger, the denial, then the cancer treatments, the end of the cancer treatment, the cancer recurrence, then living with cancer, and end of life. So these are long topics, but we will not go into details with them. I want to take you on to the cases and to the journeys of different patients in cancer treatment. So we begin with the first of a gentleman whom I saw at the Mumbai Devi Homeopathic Hospital in Mumbai, and he was a pan tobacco chewer, and he had developed a huge ulcerated tumor on his right jaw region, and he had come to the OPD with a complete bandage, and as he removed the band, you can imagine the offensivity and the stench that emanated from the tumor. And we saw him in the OPD, and we took down his symptoms, the acute totality of symptoms, which are very, very important. So he's a textile merchant. He came to the oncology OPD at the Homeopathic Hospital with a large exfoliating ulcer on the face. And he mentioned that he had severe burning pains, mild fever, and there were maggots in the ulcer. So we took him for admission in the Mumbai Devi Homeopathic Hospital, and for the severe burning pains, we gave him the remedy anthracinum 200 in homeopathy, 2 drops every 4 hours. And we did turpentine dressing for the maggots. Next day, there was a 50% relief in the pain. The patient was able to eat well, and the fever subsided. We continued with the remedy anthracinum, and the patient was and severe pain on the left side of the face, and they mentioned that she is so old, she can't take radiation, of course she can't take chemotherapy, please give us some relief. And what we were able to achieve with homeopathy is what you see. So she's a 78-year-old lady resident of Andhra Pradesh, and she had pain in the left eye with thick yellowish crusty discharge, large lesion of the palate which erodes the left orbit, the thick yellowish green discharge, and the keynote was she was better in the open air, thick yellowish green discharge, and we gave the homeopathic remedy Kali iodide 30, and she had pains which were more worse in the night. The intercurrent remedy that was given was Syphilinum 200, and 3 weeks later, she had very little discharge and the pain was reduced. We had good palliative relief. Here you see the big tumor. Case 3 is a case of breast cancer with liver metastasis. Very, very interesting case of a 37-year-old South Indian lady who came to me and in March 2007, and in the left breast there was a blood-stained discharge from the nipple. Lump was noticed. Bilateral mammography showed extensive clusters of microcalcification, and the biopsy revealed an intraductal carcinoma. 2007, she underwent a surgery called microdocotomy for the lump in the left breast, and the histopathology confirmed extensive ductal carcinoma in situ in all 3 lumps. She had underwent a left modified radical mastectomy, and she had 1 out of 11 lymph nodes in the axilla positive. May to September 2007, she took 6 cycles of chemotherapy. November 13, she had a right breast blood-stained discharge. No malignant cells, no lesion was detected. She was asked to observe every 6 months. March 2014, she noticed weight loss, hoarseness of voice, ENT left vocal cord palsy, and a CT scan of the chest showed enlarged matted necrotic mediastinal adenopathy in prevascular, pre and paratracheal spaces and the right hilum. March to December 2014, she developed severe weight loss. And in August, she had a yellowish discoloration of the sclera with severe itching. In December 14, the sonography showed multiple nodules in the liver and metastasis. So she lands up with liver metastasis. Her reports on 12th January 2015 showed the bilirubin to be 20, direct 10.3, indirect was 9.9. SGOT was 740, SGPT was 249, alkaline phosphatase 452, and she had obstructive jaundice due to liver metastasis. Her weight was only 40 kilograms. Pulse was 90, BP was 100/70. Abdomen, liver palpable, and she had severe itching all over her body with icterus. Fatigue, low appetite, and hoarseness of voice. And she comes for homeopathy treatment and mistletoe therapy. So we pursue an integrative oncology approach, and we start her on a remedy in homeopathy called Dolichos 30 and Myrica cerifera mother tincture. And we put her on mistletoe viscum album M series 1 subcutaneously. She also took ozone therapy. 27th of January 2015, serum bilirubin comes down to 8.6, direct is 7.5. And the liver enzymes slowly are coming down, as you can see. 30th January, the itching is better, 20%. 9th February, she puts on 1 kilo of weight. She becomes 41 kilograms. Itching is 40% less. Energy levels are increased. By the time we reach 24th February 2015, the total bilirubin level is 1.9 only, near normal. Liver enzymes are also near normal. And she was on Dolichos and Myrica throughout the treatment. 25th February 2015, the weight was 43 kilograms. In March, the weight became 46 kilograms. pulse 78, BP under by 70, and the itching was reduced by 95%. 6th May, her weight was 48 kilogram. Voice regained up to 80%, and she continues the Mistletoe M Series 1. 1st June, levels of bilirubin are near normal, enzymes are stable, and she has put on 10 kilos of weight as we took her examination on 3rd June 2015. In December 14, liver was enlarged. As you know, she had jaundice and a right lobe liver lesion I mentioned over here. And in June 15, with dolichos and myrica no icterus, weight 51 kilograms, she continued Mistletoe M Series 1. This case goes to show wherein liver metastases were reversed by Mistletoe and homeopathy treatment. In June 16, unfortunately, she developed breathlessness and constant dry cough. X-ray showed a bilateral pleural effusion, and we did a pleural tapping, and we instilled 400 milligrams of mistletoe intrapleurally. So viscomycin and mistletoe is used in oncology therapy in 4 ways. One is the main injection is subcutaneous, then we have intravenous, then we have intracavitary, that is intraperitoneal, intrapleural, and we have also intratumoral. So in this lady, because of the effusion, we got the pleural tapping done. So we had a surgical team with us at the Mumbai Devi Homeopathic Hospital, and we have a very good colleague, friend of ours, who's a surgeon, who agreed for mistletoe instillation intrapleurally. And they achieved pleurodesis, and patient was well, and the general condition was very good. This is a very interesting case of an ovarian cancer, stage 4, 62-year-old lady, a housewife, postmenopausal since March 2003, mother of 2 daughters, abdomen distension and acid dyspepsia. She kept on complaining of abdominal distension and acidity, black discharge per vaginum since 3 months. Normal weight, appetite, no change in bladder and bowel habits. On examination, there was a mass felt in the left iliac fossa. Mobile, firm, and non-tender mass. Bulky uterus, per speculum examination, she had a mild cystocele. Vital parameters were okay, weight was 65, BP 130 by 80, but she had, when examined her, when we did a general examination, she had bilateral supraclavicular lymph nodes. 9th February, the sonography showed bilateral ovarian masses, large, solid, cystic, with lobulated component with ascites. And her ovarian tumor marker, CA125, was 915. Okay, so she was having stage 4 ovarian cancer. Here you see the lymph nodes, supraclavicular, that are enlarged. CT scan of the abdomen showed large multilobulated bilateral adnexal masses in the pelvis. Right side and the left side showed focal loss of fat planes with sigmoid colon, uterus, and posterior wall of the urinary bladder. In fact, the right adnexal mass abutting the right external and internal iliac vessels. The right ureter is compressed and displaced. No right-sided hydronephrosis. She had mild to moderate ascites, enlarged calcified abdominal lymph nodes. And 13th February, we did a USG-guided FNAC from the right supraclavicular lesion, shows a metastatic papillary adenocarcinoma. So there she is. So she has bilateral ovarian masses, and she has supraclavicular lymph nodes, and she has enlarged mediastinal lymph nodes. And she comes for homeopathy treatment. So she goes to an oncologist, and the oncological advice was neoadjuvant chemotherapy followed by surgery. And you remember the maze that I mentioned to you in my second slide, wherein the cancer patient is watching as to where to go. What do I do exactly? So we took an integrative oncology approach There was counseling done, and the whole family had come to the clinic. And the decision taken by the patient and the family is not to go for chemotherapy and surgery. So we started her on 26th of February 2016 with Mistletoe injection M series 1 alternate days. March, after 1 month, she says she is stable, she has a good vitality, and the induction stage, there are two stages, the induction stage and the maintenance stages. The induction therapy showed a good skin reaction, and we continued a maintenance therapy with Mistletoe M injection M series 1. In May 2016, she had good health. She had some loose motions, rumbling in the abdomen, urgency for urine and stools, and she had a fear the cancer may have increased, causing symptoms. Counseling was done. We had given her some medical treatment, and I had given her carcinosin at that time, and she felt positive, and we will continue with Helixor, which is Mistletoe. She begins working in May 2016. She has some GI symptoms that are there, but her general condition and vitality is very good. It's very important that in integrative oncology and holistic medicine, I always ask a patient about the vitality quotient of the body. So you have the intelligent quotient, you have the emotional quotient, and then I have the VQ, the vitality quotient of the body. How do you feel? It's a very important question in medical therapies, in follow-up of patients. A bit later, I will tell you the three parameters that are the three questions I ask after I've given a homeopathic remedy to a patient. Before the actual disease gets better, there are certain subtle signs and symptoms that you have to evaluate. So in May, the marker came down to 567. She, of course, has the bilateral adnexal masses, but the quality of life is good. She goes to work. July 16, she's better. September 16, there was some depression, thinking about the cancer. Will I survive? What will happen to my family? Severe sadness, etc. She was given a remedy in homeopathy. The case was reviewed, and we increased the Mistletoe to series 2, a slightly higher series. In October 2016, she's much better, but the markers again become 991. But her quality of life was much better. The sadness and depression was much better. So I counsel her, and I tell her, you continue with this treatment. Birthday on October 6th, 2016 was celebrated with dancing and singing. November, she had abdominal distension, heaviness, ascites was there. Markers again 900. We started her on the intravenous mode of giving her Mistletoe therapy, that is Mistletoe M 200 milligrams. And Mistletoe P series 2 was given. In Jan 17, ascites controlled, general condition good, overall feeling better. We gave her another IV infusion of Mistletoe 200 milligrams, and her markers came down to 700. March 17, Mistletoe subcutaneous continues, and IV Mistletoe. So we give Iscamalbum IV once a month, and that is 300 milligrams. This is the picture of her ascites. We do the tapping. May 17, the weight is 58 kilograms. Cystocele, bilateral supraclavicular lymph nodes, etc. We again give her IV Mistletoe, and the markers are 677. And because of the ascites, we also do an intraperitoneal instillation of the Mistletoe, and we continue the subcutaneous Mistletoe. So she's on homeopathy treatment all throughout, and Mistletoe that is given subcutaneously and intravenously. The date that she came to me was February 2016, and today we are in 2020, so I'm going to go a bit further. Again, her weight was much better. The markers were around 753. We continue with her Mistletoe 1000 milligram intraperitoneal instillation. We tap her, remove the fluid, and we give the Mistletoe. She's still working. She goes to work. Her quality of life is good. Her two daughters sing. She goes and attends their singing programs. She comes to my clinic, and she's called the biscuit lady. She comes to my clinic, and she always brings me a pack of biscuits. Hey, Dr. Zubin, this is for you. She attends office, singing with her daughters in program, markers again stable 715. Why I'm giving you this long follow-up is to show how scientifically homeopathy and mistletoe is managing a stage 4 cancer patient. It's very, very important. Wherein at each stage, I evaluate a quality of life. In August 2018, her markers are 636. Tapping was done again, and we give an intraperitoneal instillation. She had some weight loss and some dysuria in November 2018. High dose IV mistletoe was given 1,300 milligrams, and she had good temperature reaction. 650 was her marker in November 18, and recently her marker is 453. 453. She had come to us with a marker or CA125 of 915. Now it is 453. She is still stable. She has the ascites. She has the bilateral ovarian masses, but her quality of life, there is no cachexia, there is no weight loss, and she maintains a good quality of life. Till today, she continues to be on homeopathy medicines and mistletoe. A very interesting case of a lady that came to me with an eye problem, a vision problem, choroidal metastasis, and she used to take a certain target therapy which used to cause severe pain in her toenails, paronychia, and we used to treat her with myristica for the paronychia. I just thought I'll show you this picture. Again, an integration of homeopathy with target therapies. Again, a very interesting case, study 5 of a patient with colon cancer, a 57-year-old male. He complained of flatulence, abdominal distension, and discharge of offensive flatus, griping pain in the umbilical region, weight loss, minimal. So he had this typical symptom of acidity, indigestion, sometimes semi-liquid stools, 3 to 4 stools, diarrhea, with mucus and occasional blood. And he used to give me a call, and we used to think that this could be a Giardia lamblia infection. And we gave him a remedy in homeopathy for the diarrhea, but he did not respond. He's also a hypertensive patient. So only a gas problem. So he got an upper GI endoscopy done and showed mild antral gastritis. In September 2002, there was breathlessness on climbing stairs. So in his office, while climbing stairs, he became acutely breathless. So we rushed him to the hospital. We got an ECG done. It was normal, trying to rule out any cardiac reason for the breathlessness. But the routine CBC examination showed 7 grams hemoglobin. That was a cause for concern. The hemoglobin had dropped to 7 grams. When he saw me at the clinic, you could make out the facial configuration, very pale, a very haggard, run-down face. And due to our gut feeling and my integrative medicine approach, I consulted a GI specialist, and we discussed the case. And so he says that we got an upper GI endoscopy done. Let's do a colonoscopy. So we got a colonoscopy done. And there we could find out a polypoidal growth in the proximal transverse colon. And it was an adenocarcinoma, moderately differentiated. 7 September, stool examination. 16 September 2002, here and right extended hemicolectomy was performed. It was a moderately differentiated adenocarcinoma colon, Duke stage B. Surgery was complete, good recovery. So we gave him calendula 30 for recovery from surgery. November 2002, first cycle of chemotherapy was started with 5-fluorouracil. So here post-surgery, again, we had the discussion, an integrative oncology discussion with the family, wherein we sat down and we tried to discuss as what is the pathway forward? What do you want to do? And the patient said, no, we have been advised to do chemotherapy. We are going to go in for chemotherapy, but we will continue with homeopathy, and we would like you to be part of the journey. So November 2002, first cycle of chemotherapy was started. He had some weakness, flatulence, eructations. We managed him with carbo-veg. December 2002, second cycle of chemotherapy, which was tolerated well. January 2003, Third cycle of chemotherapy showed severe side effects. He had severe diarrhea, mouth ulcers, dehydration. 8 p.m. I had a phone call at the clinic. Very offensive stools. Wife cannot enter toilet after patient passes the stool. That goes to show the stench and the offensivity of motions. Scanty urine, giddiness, weakness, advise hospitalization. 11 p.m. we admitted him in Beach Candy Hospital, and there and then we started the homeopathic remedy. The wife was a great believer in homeopathy. She told me, nothing doing, you please get the remedy from your clinic. So I go to the hospital and we give the homeopathic remedy, podophyllum. The diarrhea became much better with podophyllum, though he was also on, you must understand that he's in a hospital with diarrhea, so they've given IV antibiotics as well. 7 days, stool became normal, patient decides to continue chemotherapy. February 2003, fourth cycle of chemotherapy, severe weakness, 8 to 10 loose motions, vomiting, fever, can hardly walk. And after the patient returns home, he collapses. So I receive an emergency call. Blood pressure was 90/70, pulse was steady, feeble, coldness of the body with perspiration. Query, a head injury, he had a fall in the bedroom, no one knew what was the impact. We examined him and we started the patient there and then on Veratrum album 200 and Electral given at home to cover the collapse. So you see over here, podophyllum was given and then we gave Veratrum album and we began with calendula. So at every stage, you have to change the homeopathic remedy depending on the condition of the patient. He's hospitalized. After 6 hours, he's stable. I go to the hospital and visit him. How are you feeling? I am feeling better. We continue Veratrum album 200 every 4 hourly for 4 days. 7th day of the 4th chemotherapy, he develops mouth ulcers. So he's collapsed and he's got mouth ulcers with difficulty in eating and drinking. Again, he's advised good hydration, vitamins, and his blood parameters show low hemoglobin levels and leukopenia. Severe weakness and can hardly control his urine. Shivering and low moods, and he's depressed due to failing health. So you can imagine he's undergone surgery, he's undergone 3 cycles of chemotherapy, and each cycle of chemotherapy, he has a setback, diarrhea, collapse, mouth ulcers. And we give him the homeopathic remedy called muriatic acid 200. And he is discharged from the hospital. We come to the month of April. Again, counseling. Patient family decides to stop chemotherapy. The patient says, enough is enough. I cannot take it anymore. I'm going to continue with mistletoe and homeopathy treatment. 2003. And the constitutional homeopathic case history was taken. He's quite a quiet, kind, gentle person, soft tone of talking, very nurturing, very encouraging. And he had this main keynote symptom of scratching of the head when thinking and when he wake up in the morning. He had desire for eggs and ice cream, and we start him on the homeopathic remedy calcarea carb 0/1 and mistletoe therapy Helixor A series 1 subcutaneously. June, I'm giving you a follow-up month by month, step by step. June, feeling much better, recovered from surgery, stools normal, flatulence, eructation better. July, resumes office and he gains 3 kilos of weight. Intercurrent remedy was Struja, calcarea carb 0/1, 3 doses per week for 1 month. 2005, the checkup, normal CT scan, no metastasis. 2007, normal calcarea carb once a week only. 2009, he had a minor upset. He developed acute abdominal pain and he was admitted into slow hospital. He was writhing in pain, history of stress in the office, a discord, an extreme anger and vexation. Again, I go to the hospital in the night and I examine him, and I was aware as a holistic physician, as a homeopathic doctor, of the impact of the mind and the body. And I was asking him, and I was aware there were some issues that this gentleman was facing with a few of his colleagues. And we give him the remedy Colosynth 1. 6 pills every 2 hourly. Though he was on painkillers for the abdominal pain, with colocin, the pain became better much faster and the pain reduced by 70% the next day itself. In 2 days, he was discharged, comes home. 2010, we restart Calcarea carb as the constitutional homeopathic remedy. 2011, patient normal, no disease, no metastasis. 2012, 13, 14, 18, 19, till the last time I knew the patient is doing well. So herein, what have we done? We've done not a very high funda approach. The homeopathic doctor was there, present in the whole cancer journey of the patient. So you saw calendula being used, podophyllum being used, veratrum being used, and each time the ailment, the duration of ailment was reduced. Now there was an integrative medicine approach, mind you, but the homeopathic doctor was there at every stage. You go to the next case, again case number 6, case study number 6 of a 63-year-old housewife with severe constipation since years. No urge for stool for 3 to 4 days. Stool she had, the first part was hard, then it was soft. And she had to strain for stools or manually remove the stool with fingers. She had some altered bowel habits, constipation alternating with loose motions, and she had some weight loss over 2 years. March 23, she had acute abdominal pain, crampy, griping in nature, no stool for 4 days, and she had mild ascites. The sonography showed dilated bowel loops. CT scan showed a thickening of the wall of with narrowing of the lumen, and there was also a nodular enhancing lesion in the head of the pancreas. These were the parameters, and the marker 19-9 was 10,700. April 1st, she was taken for exploratory laparotomy with a right hemicolectomy, and a gastrojejunostomy was done. And it was a metastatic adenocarcinoma consistent with a pancreatic adenocarcinoma. Recovery after surgery was stable. She was put on Pantocid and some painkillers. The main pain-killing medicine was Narcotin 4. Again, the next step post-surgery, they took an oncological opinion and they were advised chemotherapy, gemcitabine, and oxaliplatin. The family knew me since many years. I had treated many members of the family with cancer, so they knew about Mistletoe, they knew about Helixor, and the prognosis was discussed with the family. And the patient did not want to take chemotherapy. A palliative integrative oncology approach was taken, and patient was evaluated, and we started with Carboveg 30 because of a lot of gas issues, and Mistletoe therapy, and Iscador was given at that time. She had the main symptom due to the subacute intestinal obstruction of vomiting, and she says that vomiting starts at sunset and lasts till sunrise. The severe night aggravation of the vomiting. Daytime she is better. Again, a very simple remedy in homeopathy, night aggravation of vomiting. We gave her Syphilinum 203 doses on May 7th. May 10, status quo in vomiting, Syphilinum 200 OD was given. May 16th, less vomiting and weakness, and she had some constipation. Again, there was a relapse. She had abdominal pain with increasing distension, cachexia, and abdominal girth was 30.5 inches. And again, Mistletoe was given MCHG subcutaneously, and we gave an IV infusion of Mistletoe of Helixor 50 milligrams. We repeated the IV infusion on May 28th, and subcutaneous Mistletoe continues. Weakness, vomiting, loose motions, arsenic alb was given at that time. And again, the night aggravation of vomiting persisted. We gave a Syphilinum 1M and another IV infusion of Helixor M. So Mistletoe was given subcutaneously as well as intravenously. Vomiting was controlled, less loose motions. In between, she went into acute intestinal obstruction, and she was on narcogen forte, severe constipation, no stool since 5 days, and we had given her opium at that time, 200 QDS. Iscado continues, IV infusion of Helixo continues, Cifalinum 1M 1 dose. Tablet narcogen fort was stopped since July 4th. She didn't require any painkiller. She was managed with Cifalinum and the homeopathic remedy and mistletoe. Mind you, she had a huge mass in the pancreas as well as the colon. Patient drinks a few sips of lemonade 5 days before she passes away. Again, palliative relief achieved at home in case of advanced metastatic carcinoma. This is a case of a lady who had an alveolar carcinoma of the left jaw, and she had a sinus that was dripping with pus, and she had taken radiation at that time, and post radiation she had a condition what is called as an osteoradionecrosis of the jawbone of the mandible, with a sinus formation, with a pus secretion, and we had given her phosphorus in homeopathy and mistletoe, and it has filled up, it has healed. Another case that I saw of a lady, a bank officer, 56-year-old lady with a huge swelling of the left lower limb, and she comes to me and she tells me, "This is my problem, doctor." So she's a case of ovarian cancer with widespread metastasis in the pelvic lymph nodes. So pelvic lymph node metastasis with anemia, her hemoglobin at that time was 7 grams %. And she had no appetite, and she has a history of having serous cyst adenocarcinoma of the ovary that operated 2 years ago, and she had taken 12 cycles of chemotherapy. In the life history, she mentions, I asked her, I said, fine, you've taken 12 cycles of chemotherapy, you've had your surgery, you've come to me in stage 4 of your condition. Tell me your story. It's a very beautiful question in medical practice, because in oncology, in cancer treatment, patients normally come with a huge pack of reports, and they give you, this is chemotherapy, this is radiation, this is blood test, etc. I always tell them, tell me your story. And she says, I want to work. I want to work, and I've always been struggling with financial issues throughout my life, have overcome all struggles of a housewife through sheer hard work, working 7 days of the week and 365 days of the year. Just give me some medicine so I can go to work. मुझे काम करना है, बस मुझे काम करना है, मुझे पैसे कमाने हैं, घर चलाना है. And she had a hard swelling of the left lower limb. She had a marked concern, what will people say in her history, what will happen to her family, as she has the lone bread earner of the family, desire for spicy, desire for ice cream, and she had exostosis on her feet and a strong sexual desire. And calcarea floor was the homeopathic remedy that was selected. 0/1 was given in millisievert potency in September 2007. October 2007, appetite better by 20%, does household duties. December 2007, appetite better by 70%. Her hemoglobin improves from 7 to 8.4 grams % with homeopathy treatment. January 2008, she starts working half day, very happy to restart work. And she comes back to her structure and her sense of coherence, like I mentioned to you in salutogenesis. And the remedy in homeopathy was calcarea floor, 0/3. February, she began her on Mistletoe Elixorem Series 1, and her hemoglobin in April 2008 was 9 grams %, appetite good, no weakness, and she continues her work. June, she has some weakness and left limb pain because of overexertion. Calcarea floor was increased to 0/6. August 2008, stable and working. Patient is stable. Jan 2009, she complains of abdominal pain. November, well, she has abdominal pain in Jan 2009. She had some night aggravation. We'd given her syphilinum 1M, 1 dose intercurrently. Again, unfortunately, her hemoglobin dropped to 6 grams percent and she developed pulmonary metastasis. She continued to work despite the pulmonary metastasis and the low hemoglobin. In March 2009, she expired. Good palliative relief and a quality of life. So what she wanted in stage 4 of cancer, I asked her, I said, what do you want? She said, I want to work. And Calcarea Floor enabled her to work in the last few months of her life. That's the power of a combination when you give a stage 4 patient homeopathy and mistletoe therapy. Case study 8. It's a very beautiful case of a right breast lump of a patient noticed in May, CA of the breast in her sister, and she had a modified radical mastectomy done with an axillary clearance. 5 out of 9 lymph nodes showed metastasis. Now here a funny thing happened in this case. September 2017, she took chemotherapy. And she developed an ulcer on the hand. And they wanted me to treat her ulcer. She says, just treat my ulcer. I'm not able to work. I'm having pain, etc. My quality of life is affected. So we start her on homeopathy treatment. And you see the gradual improvement in her case, and her ulcer has healed completely. There she is coming to my clinic and she's giving me Tilgul on Makar Sankranti, and she's absolutely fine. She has taken just 2 cycles of chemotherapy and she's been on mistletoe for about 2 years. And she's perfect, no cachexia, quality of life is good. She's doing all her household chores, living a happy, fulfilling life. So we've actually added life to days in the patient that I've shown you, in the patient that was working, in the patient of this ulcer of the hand. And that is what is important and can be achieved with an integrative oncology approach. Thank you very much for a very patient hearing. I've tried to present the work that I've been doing in the field of cancer, homeopathy and mistletoe therapy of cancer. If there are any questions, please let me know.
Thank you so much, sir. There are so many questions. Let's just begin with the question answer session. Everybody is asking. So, sir, I will start with the first question that came for you from Dr. Rashmi. She wanted to know how do we ensure the balance between cell division and cell death?
How do you ensure the balance between cell division
Differentiate between the yes, sir. How do you ensure the balance between the cell division and cell death?
Well, there are no parameters to measure the balance between cell division and cell death. In fact, you have to look at the family history of the patient, wherein you have to look at what are the level of disorders in the family the patient has got. Are there disorders that are degenerative? Are there disorders that are proliferative? Are there disorders that are inflammatory? And accordingly to that, you can judge. But there are no particular lab parameters to judge. Next question.
Thank you, sir. Thank you. There is one more question from her only. If there is a history of cancer in the maternal and paternal family tree of 2 generations, is there anything that homeopathy offers to break the chain in these current or further generations?
Definitely, I think the advantage of the history we take in detail in homeopathy to identify the family history is our best point. And definitely you have to see and see the past medical history, see the miasmatic history, what is the dominant miasm, and based on the fundamental miasm, you give your remedy. Next question.
Thank you, sir. There is one more question. What is the connection of warts and cancer?
Both are proliferative growths, right? Psychotic miasm, and psychotic miasm is a known feature in malignancy.
Sir, there is one more. There are 5 questions from Dr. Wafa. He's posted. First question was, what are the other uses of mistletoe besides cancer? Can they be used for respiratory distress syndrome, or can we use it during COVID?
Yes, that's a very interesting question. The question is from which doctor you mentioned, Yashika?
Wafa. I
No,
think
I
he's
think
from Egypt.
in COVID also, to balance the immune system and to prevent the immune system from going haywire, what I mean is the cytokine storm, mistletoe can be used. So there are studies that are being done right now in Germany for COVID-19 and mistletoe, and I am in touch with them, but we've not been able to establish anything definite. So unfortunately, we are not able to use mistletoe to kind of balance out the cytokine storm. But in case of HIV positive cases, mistletoe has been used in Germany. Also in autoimmune disorders, mistletoe has been used. Next question.
Thank you, sir. I'll just tell you the next question again from Dr. Wafa only. Which is the preferred mistletoe in specific cancers?
Well, you prescribe the mistletoe based on your experience, based on the patient's general condition, the patient's condition of the immune system, the hemoglobin levels, the white cell count, and the staging of the tumor. So depending on all these parameters, we select the helixor therapy, the mistletoe, whether it is from the host tree, that is Abiatus, or helixor A, or helixor M from Mali, the apple tree, or helixor P, that is the pine tree.
Thank you, sir. Third question again from Dr. Wafa. For financial reasons, sometimes Abnoba is cheaper than Helixer. And Abnoba state that FE injections are as effective as Helixer 4. What is your experience using both the types?
Well, I've only used Iscador and Helixor. I've not yet used Abnoba, so I will not be able to comment. Right now, I'm using only Helixor, and I'm perfectly happy with the results.
Sir, so he has posted one more question. When do you know that the maintenance dose is not working? When rash and fever disappear? And can you space it out to twice or once a week depending on the tumor status?
Basically, the basic idea of mistletoe is to increase body temperature to bring about a very mild hypothermia. And many times the local skin reaction and the general temperature reaction may not be the parameter to evaluate a patient. Many a times after a few months, we see that the local skin reaction, temperature reaction disappears. But we continue evaluating the patient based on the general condition, the appetite, the sleep, the mood factors, etc. So general parameters and parameters that are hemodynamic are used to evaluate a patient.
Sir, he's also asking which is the best mistletoe preparation for lymphoma and leukemia? Any specific, any specific precautions?
We had a case. I should have. I wanted to bring that case to you today, Yashika, but it's a very long follow-up case. You can understand. I think all the participants could make out from the history that I have brought. I've tried to bring you in a nutshell of cases which have been managed with mistletoe and homeopathy. I could not bring the long follow-ups, but we had a case of acute myeloid leukemia in Mumbai, which we were treating with homeopathy and mistletoe, and the patient is very stable right now. Patient is on a maintenance therapy of 6-MP and methotrexate once a week Mistletoe, Helixor, and homeopathy. All these three things are going together, and this lady is doing fine.
Yes, there is one more question from Dr. Sujit Rathod. He has seen mistletoe injection are infused into intratumoral or intrapleural. Is it possible for homeopathic doctor to implement the same?
Well, if you want to go ahead in life and if you want to learn a therapy and use a therapy for the well being of a patient, then I believe nothing should stop you. And there have been mention about hypodermic therapies in boric materia medica. So, considering that we have a therapy today in mistletoe, which is helping cancer patients, which is well documented, both in homeopathy and in European countries, we should use it because it becomes a very, very important tool for a homeopathic physician if they have it in the treatment of cancer, in the treatment of their cancer patients. Okay, Ashika,
Sir,
is there
there
any
is
other question?
yes. There is another question from Dr. Wafa again. Mistletoe is contraindicated in autoimmune diseases or thyroiditis.
Well, the dosage you give in autoimmune condition is very, very minimal. It's extremely minimal, and a lot of research is going on in this field. It is still an off-label use. We still haven't used it a lot, so it's very hard to comment, especially with a very, very sensitive autoimmune condition like thyroiditis. A lot of research needs to be done still.
Thank you, sir. Dr. Sujit, sir already told that he's using what he using. Sir, he is asking mistletoe. You started with Helixer or Abnova?
Elixir.
Okay, sir. So, sir, there is one more question from Dr. Navjinder. Do you use oral preparation of mistletoe? If so, which one is better, SC or oral?
You have to understand that mistletoe and all the research on mistletoe is basically done for subcutaneous injection. Mistletoe has to be given as a subcutaneous injections, and oral mistletoe is given only in certain conditions of brain tumors and spinal tumors, wherein you don't give the injection to avoid a peritumoral edema or a perifocal edema around the tumor. So mistletoe must and should be given in a subcutaneous way. That is the way it was meant to be given, and that is the standard way of administering mistletoe. Oral mistletoe is only for brain and spinal metastasis. The oral mistletoe is also less effective than subcutaneous mistletoe.
Sir, there is another question from Dr. Sujit again. So how to approach in cases when there is metastasis to other organs? In such cases, do we need to focus on primary site or the secondary site?
Well, ideally, you have to focus on the primary histopathology of the tumor, what the tumor is, and only then you start the mistletoe. It does not matter as to which organ it has metastasized. You have to go by the primary site of the tumor and then give mistletoe and give helixor according to the staging of the tumor, the condition of the patient, whether the patient has taken chemotherapy in metastasis or not taken chemotherapy. So all these factors have to be judged.
Thank you, sir. Dr. Sadhna wants to know, is mistletoe injections prepared homeopathically?
No, they are prepared according to anthroposophical principles. So this is a branch of medicine, what is called as anthroposophy, and you should read about it. It's a very, very interesting branch of medicine, which has also a holistic basis to an understanding of a disease, just like homeopathy. Are there any other
Thank you,
questions?
sir. Yes, sir. Sir, there is a question. Please tell about this word series. What is meant to this injection?
So
Dr. Mukti
basically,
wants to know.
yeah, so basically, mistletoe, I think we need to hold a separate mistletoe webinar, Yashika, depending on the need of whatever people want. I hope I was able to give you a basic idea of what mistletoe therapy is about. So coming to series means the concentration of mistletoe in a certain rhythm. So the mistletoe plant is given as a series of series 1, wherein there are 3 concentrations, series 2, a slightly higher concentration. So in series, you have a pack of 7 ampules in one box, and you give it subcutaneously in rising concentrations. So series basically means the milligram concentrations in a gradually rising pattern.
Thank you so much, sir. Sir, Dr. Sujit wants to know where do we need to infuse mistletoe? In intrapleural, intraperitoneal, or is there any point we need to focus?
That's the thing, mistletoe is basically given subcutaneously, and in cases of metastasis, you give intravenous. In case of ascites, we give intraperitoneal. In cases of chest or pleural effusion, we give intrapleural.
Sir, any more questions? Can homeopathic medicines work when patients are bombarded with chemotherapy and so many allopathic drugs?
Oh, yes, they can work. Homeopathic remedies can work. I have showed you the case of podophyllum. After chemotherapy, the diarrhea with loose, offensive motions. Oh, yes, yes, it works. I've showed you the case of the ulcer of the hand
Yes,
with calendula.
yes, sir. Sir, Dr. Shobha wants to know mistletoe A versus mistletoe M versus mistletoe PPH.
The Shobha, mistletoe A is basically given for a general immune response wherein the immune system is weakened by chemotherapy and radiation. A patient has just come out of surgery wherein the immune system is weak and you want to slowly build it up. Then you give mistletoe A. For certain tumors of the GI tract, we give helix or M or mistletoe M. And if you want a stronger immunogenic response in a shorter time, we give mistletoe P.
Thank you, sir. I want to update, sir. Somebody is wishing you from Anaheim. Dr. Lisa is here. Dr. Lisa Isabella. I want to tell her that we have this webinar on YouTube as well. It was going on live on YouTube, so you can watch this the replay of this webinar on YouTube, as well as you will be getting a recording of this webinar, replay recording on your mails just after the webinar. Within 2 to 3 hours, you will receive the certificate as well as the replay link of this webinar, so you can watch. Dr. Lisa. Sir, there is one more question. What time do you recommend mistletoe injection? Morning or afternoon?
Mornings, always mornings.
So there is another question from Dr. Mrunal. You told that you asked patient that they have warts in past history. So what is the relation of warts in cancer?
I told you already, it's psychotic miasm, right? Most malignant growth is a cancerous tissue, is a growth. Again, it's the primary miasm is the psychotic miasm. So to identify prevalence of psychotic miasm in different generations, we ask the history of warts.
You, sir. One last question. I think can mistletoe therapy be given along with immunotherapy, nivolumab, or not?
Yes, yes. A very, very interesting question. So a lot of research has been done in using immunotherapies in cancer treatment. And yes, it can be given with immunotherapies. Currently, I have a patient of lung cancer who is taking immunotherapy, and side by side, they've taken mistletoe, and he's doing very well.
Thank you, sir. Any other question? Do you recommend a specific time? He already told mornings. Dr. Nilo, he already told that the specific time for mistletoe injection is mornings. So, any other questions? I would like to request the audience to please type in your questions if you have any queries from Sir. Sir, by the time I request you to please post your email ID or contact number in the chat box so that people may contact you if they are left with queries.
Sure, sure. Are there any other questions, Yashika, or should we wind up
Yes,
the
we'll be
webinar?
winding up. We'll be winding up. Please type in your email ID.
Yeah, yeah, yeah. 1 minute. Yeah, 1 minute.
Yes, sir.
Okay.
Thank you so much, sir. So the attendees can contact him on ZUBIN at the rate ENLIFEN Zubin
Correct,
at the rate enlifen.in.
correct, correct.
So I request the audience if you are still left with the queries. I hope we had discussed all the queries. Still, if anybody is having any query which is left, you can personally contact sir on this email ID. And now I think this is time that I should thank the speaker of the day, sir. Thank you so much. My heartful thanks on behalf of the team of Homeopathy 360 as well as BJN that you took out your valuable time and guided all the learners who have been with us today so beautifully on mistletoe therapy, Wiscom album, covering each and every aspect and dealing with cases of cancer, critical cases of cancer with mistletoe therapy and taking homeopathy to another level. So, thank you so much, sir, for your time. And before I sign off today, I very more important vote of thanks goes to my team of Homeopathy 360, who is working day in and out to bring out all informations as well as these webinars for the homeopathic fraternity. So and also to all the whole audience who has been with us for the webinar for such a patient listening. Stay connected with us and keep participating. Likewise, you will receive the certificate as well as the replay recording of this webinar on your mails after the webinar within 2 to 4 hours. And we'll also be sharing a recorded version of this webinar on our YouTube channel, as well as it will be available on our website at video section. So you can visit the website or the YouTube channel for our webinar videos. The previous webinars as well as today's webinar, all are available on our YouTube channel. And for any queries regarding article submissions, etc., you can mail me at yashika@homeopathy360.com. For any queries related to webinars, you can mail me at webinar@homeopathy360.com. We would love to hear from you. So thank you everyone for taking out time and being here today with us. And you are also requested to follow us on our social media accounts of Facebook and our Facebook group of Homeopathy 360, having homeopaths from all over the world. So you can join us at our Facebook group as well as our all other social pages. So thank you so much once again, Dr. Zubin sir, for being with us today for such a wonderful session. Everybody enjoyed it a lot and learned a lot from this session. There are comments which are coming from different doctors that there was a great learning experience, a great informative session with so many beautiful cases. So thank you so much for covering this aspect of homeopathy. And if you want to say something, I hand over to you.
Well, I think, as I mentioned, first of all, I would like to thank Homeopathy 360 and Mr. Manish Jain and Dr. Yashika Arora for inviting me to present my work. Treating cancer is a challenge. It's been a challenge for me in the last 30 years of my life, from 1991 till 2020. And I hope to take homeopathy to new levels and to help cancer patients live a good quality of life, to combat cancer. I hope you all are safe and well in these COVID times. And I hope that we could do more research on mistletoe and COVID in future. Thank you very much for a patient hearing, and thank you, Yashika. Thank you very much.
Thank you so much, sir. So we wind up today. For tomorrow's webinar, you can visit our website for the registration. If you want, I'll just post the link of the tomorrow's webinar. We have a webinar tomorrow at 3 o'clock of Dr. Poonam Gopal Krishnan. She'll be discussing on the topic of thyroid, that is thyroid storm, and she'll be discussing the different aspects as well as whatever is related to thyroid and all the complications of hypothyroidism and hyperthyroidism. So you can visit this website and visit this link on the website and register for the same if you want to attend. Plus, we have a clinical series also coming up after day after tomorrow, from 14th of July to 18th of July, by different speakers from Maharashtra as well as Kolkata as well as North India. So you can visit the same again for on our website. I'll post the link of that same webinar series, which is coming up with the best speakers to understand the secrets of clinical homeopathy. For any other queries, you can mail me at webinar@homeopathy360.com. So thank you so much. We wind up this session. Thank you.
Very much, Yashika. Thank you.